My name is Mr. Tipple. I am the instructor of the Sports Medicine Rehab Therapy program here at Beatty. This program is for students interested in the rehab sciences, so physical therapy, occupational therapy, athletic training, personal training, rehab aid, or being an assistant in any of those type of careers. As you look and you'll get a tour of this facility, this is set up as a real rehab facility. Everything here works. Everything here needs to be taken care of, and the students learn how to take care of it as well as to operate it and use it correctly. If you're interested in this program, it's very heavy in anatomy to start with. We kind of focus a lot on the body systems, especially the skeletal system and the muscular system. We then move on to athletic training, learning how to tape, how to help an athlete off the field, and to treat them for whatever type of injuries that they have. Third year, we focus more on personal training, and students that successfully complete the third year, they can earn their personal training certificate and be able to work as a personal trainer right out of high school. So behind me is the anatomage table. This is one of the tools that we use to reinforce anatomy. It uses a real digital cadaver, and just by touching on the different parts, the students can learn the names of the different muscles and the different parts of the anatomy, as well as being able to know what those parts do and how to rehab them. Over here is Steve. This is our school skeleton that we use for class. The students like to work with Steve, especially to learn all of the bones. You will learn and know how to spell every bone in the human body when you're done with the program. And you can see that the colored sides on here show where the various muscles originate and insert on the body, and students need to know that so that they're able to figure out and fix athletes or their future patients. So some of the equipment that we have here for the students to practice with and also learn how to work includes the Game Ready, which is a cryocompression unit for athletes or people with injuries to reduce swelling as well as pain to help with the rehab. We do have an ultrasound unit as well that works. The students can actually see and feel what it feels like to get therapeutic ultrasound. Behind that is our upper body exerciser for upper body cardio activities. As we come along here, we do have free weights for the students to use. All of this equipment in here, when we do have free time towards the end of class, the students are able to use once they're checked out on it, to be able to use it properly and to work towards any goals that they have. If they want to work on improving their strength or their coordination, their endurance, that kind of stuff. Over here, we do have more of the cardio type of equipment, such as the elliptical, some free weights in the back for the upper and lower extremities, and regular stationary bikes. And on this side, we do have the treadmill and a recumbent bike, which is good for patients that may have low back pain, but also want to work on their cardio. As we come over here, we do have a fully functioning working traction table. Students do practice to set their classmates up on it for both their low back and their neck. There is a video available on the Beatty website showing students in action doing that. Students do have a lot of fun learning how to set up each other on the traction table. Over here we have a lymphedema pump for patients that may have increased swelling in their lower extremity to help pump the fluid back into the general regular part of their body. Over here is our modality section. So thermal modalities such as hot pack and cold pack. The water in here is at 160 degrees. The hot packs do sit in the water, and students learn how to set patients up on hot packs and cold packs to be able to apply to somebody that may have an injury or pain or swelling in certain areas. And so that is actually one of the first things that students learn to do when they start the program. As students move along through the program, they get to learn more about the actual equipment, how to set it up on patients and what it's for. Here we have a TENS unit, which is commonly used for patients with pain. We have an iontophoresis unit that is used to reduce swelling. And then students in the second year get to learn more about goniometry, or being able to measure all of the different joints of the body, from the elbow to the knee to the neck and beyond. So we have all the different equipment for students to learn how to measure different joints, and that's important for patients or athletes to be able to reach their goals, to see how much motion that they're limited in, and how much more they have to go to reach whatever they need to go to. Over here, I just have some examples of some of the equipment that the students get to learn to use as an athletic trainer. We have spray, lube, and different pieces of types of taping and wraps for being able to wrap different joints or different injured parts of possible student athletes. Students get to learn how to use this to be able to go out and do athletic training internships basically with some of the local colleges. They're able to job shadow with some of the local schools and be able to work with the local athletes. Over here is one of the newer pieces of equipment that we have, our multi-gym. Again, students learn how to set all people up on all the different equipment, and then again, once they are safely able to do so, they can use this equipment for themselves when we have free time to work to either improve their strength or their motion. So that is the basic rundown of our sports medicine rehab therapy program at Beatty. I will say it is a challenging program, but it's a very rewarding program. Some of my graduate students have gone on to physical therapy school at schools such as Gannon and Slippery Rock. We also do have articulation agreements with several of the local colleges, including Waynesburg for athletic training and LaRoche for medical terminology. And we're currently working on some others for some other local schools as well. So one of the big benefits of the sports medicine program is that students get to borrow from the experience of both myself, who is a physical therapist for almost 20 years, and Mrs. Lang, our helper, who has been an athletic trainer for almost 25 years. The experience that the students get from that is able to carry on through their possible future careers. Mrs. Lang and myself are more than willing to answer any questions that you may have. We look forward to hearing from you and seeing you in person when possible. So please feel free to reach out to us, and we'll be happy to answer any questions you have.